Swine flu, also known as the H1N1 virus, was first identified in 1930. The H1N1 virus is a subtype of influenza, a virus that commonly causes infections in pigs. The virus is notable for its ability to occasionally cross species barriers and infect humans, which has led to several outbreaks over the years. The most notable outbreak of H1N1 swine flu in recent history occurred in 2009, when a new strain of the virus emerged and caused a global pandemic. This 2009 H1N1 virus was initially referred to as swine flu, because laboratory tests showed that many of its genes were very similar to influenza viruses that normally occur in pigs in North America. However, further study showed that the 2009 H1N1 virus contained a unique combination of influenza genes not previously identified in animals or humans. Swine flu primarily spreads through the respiratory route, following mechanisms similar to those of other strains of influenza. The virus is most commonly transmitted via droplets that are expelled into the air when an infected person coughs, sneezes, or talks. These droplets can travel through the air and land in the mouths or noses of people who are nearby, typically within about 6 feet, and may be inhaled into the lungs. In addition to airborne transmission, swine flu can also spread through contact with contaminated surfaces. Individuals may contract the virus by touching objects or surfaces that have been touched by an infected person and then touching their own mouth, nose, or eyes, thereby facilitating the entry of the virus into their system. Close contact with an infected person, such as living with them or caring for them, significantly increases the risk of transmission. Although human-to-human transmission is the primary method of spreading the virus, swine flu can also cross species barriers. It can be transmitted from pigs to humans in situations where individuals are in close contact with infected pigs. This cross-species transmission is particularly concerning as it can lead to the reassortment of the virus, potentially giving rise to new and more virulent influenza strains. To mitigate the spread of swine flu, preventive measures are recommended. These include receiving vaccinations, practicing good hygiene habits like regular hand washing, using tissues or the crook of your elbow to cover your mouth and nose when coughing or sneezing, and maintaining a safe distance from those who are infected. These strategies are essential for controlling the spread of the virus and protecting public health. Swine flu, caused by the H1N1 virus, manifests symptoms in humans that closely resemble those of seasonal influenza, though the severity can vary from mild to significant. Affected individuals typically experience a constellation of symptoms, starting with fever and chills, although not everyone may have a fever. A persistent cough, which can be either dry or productive, is another hallmark symptom, often accompanied by a sore or scratchy throat, contributing to overall discomfort. Nasal congestion or a runny nose adds to the respiratory distress, making breathing uncomfortable. The illness often brings widespread muscle or body aches, which can be debilitating, along with severe headaches, further exacerbating the individual's discomfort. Fatigue is another significant symptom, leading to a profound feeling of tiredness or weakness that can interfere with daily activities. While less common, some individuals, particularly children, may also experience gastrointestinal symptoms such as vomiting and diarrhea, broadening the spectrum of swine flu's impact on the body. These symptoms collectively disrupt normal life, requiring individuals to rest and, in many cases, seek medical attention to manage the symptoms effectively and mitigate the risk of complications. Swine flu can be particularly perilous for high-risk groups, including young children, the elderly, pregnant women, and those with chronic health conditions or compromised immune systems. For these individuals, prompt medical consultation is advised to determine the appropriate treatment strategy, which may include antiviral medications, ensuring adequate hydration, and maintaining rest to support recovery. Treating swine flu involves a multifaceted approach that focuses on alleviating symptoms, preventing complications, and inhibiting the virus's spread. At the core of treatment are supportive care measures aimed at managing symptoms and ensuring comfort. This includes ample rest, which is crucial for the body's recovery process, and staying well hydrated to counteract the effects of fever, vomiting, or diarrhea. Pain relievers and fever reducers such as acetaminophen or ibuprofen play a significant role in controlling fever, sore throat, and body aches. making the illness more bearable. When it comes to directly combating the virus, antiviral medications like oseltamivir or zanamivir can be effective, particularly when administered within the first 2 days of symptom onset. These medications can shorten the duration of the illness and are especially important for those at greater risk of severe outcomes. They work by inhibiting the virus's replication, helping to reduce the severity of symptoms and the likelihood of serious complications. Preventing the spread of swine flu is equally important. Individuals infected with the virus are advised to isolate themselves from others to prevent transmission. Practicing good respiratory hygiene, such as covering the mouth and nose with a tissue or the inside of the elbow when coughing or sneezing, and frequent hand washing, are key measures to reduce the spread of germs. In certain situations, wearing a mask can also help minimize the risk of infecting others, especially in crowded or enclosed spaces. Vaccination represents a preemptive defense against swine flu, with seasonal flu vaccines typically including protection against the H1N1 strain. Annual vaccination is recommended for most people and is particularly crucial for those at heightened risk of flu complications. This preventive strategy is instrumental in reducing the incidence of swine flu and mitigating its impact on public health. For those experiencing symptoms of swine flu or at high risk of complications, prompt consultation with a healthcare provider is essential. This ensures accurate diagnosis and the formulation of an appropriate treatment plan tailored to the individual's specific needs and health status.